If you have trouble walking pain-free with lumbar spinal stenosis, I'm going to show you how I use the treadmill for myself and my patients in order to walk miles and miles pain-free with the lumbar spinal stenosis. Now, there's three advantages to using that treadmill. The first one is that you can control your environment. For example, you can use the incline, and we typically recommend people to start off at 2 to 4 levels on the incline, and that allows for a little bit more flex posture, and that will allow people to walk longer without going into pain with the lumbar spinal stenosis. The second advantage is that you can self-decompress when you want, because typically when you go out for a walk, you have to be very strategic. You have to find a place where you can self-decompress off of a wall, a fence, or a bench. So this allows you to use those guardrails to self-decompress when you want. The third advantage is that you can self-decompress as you walk, so you don't even have to stop. And that's a great advantage because then you just self-decompress, you continue to walk until the symptoms release a little bit, then you resume your walk and you can walk longer without pain. Now, before you step on that treadmill, it's important to have good intentions. You have your goal, and the goal should be set. So, for example, if you have a goal of 2 miles, that's great. So you're going to gradually work up and scale it over time to get to that point, because some people may start off and they can only walk a few feet before they start getting the pain. But if you apply these techniques that we're talking about in this walking video, you're going to walk a lot longer at first without pain than you ever thought you could. So it's important to have that goal set. The next step is to warm up properly. There's 3 reasons why, because number one, with lumbar spinal stenosis, there's a lot of scar tissue, which means there's a lack of blood supply. And typically, if you just go out and walk, you're not going to be warmed up. It's a much higher rate to where you're going to glitch up the spine. You're going to go into pain sooner. So it's very important to do those warm-up exercises to increase blood flow. The second reason is that part of the warm-up is you can do flexion-based exercises. The flexion-based exercises will open up that stenotic canal. It rests, relaxes, and desensitizes that nerves, really gets you ready for that walk. And the third reason is that you're going to activate those core muscles to strengthen and stabilize and stiffen up the spine to where when you go out for that walk, it's going to be less likely you're going to get little micro slippages of the spine and cause it to go into pain. So very important to do that complete warm-up. It's only going to take between 5 and 7 minutes. Next thing, it's very important to have the proper posture as you walk, because people that have lumbar spinal stenosis are going to be stuck in a flexed posture. Their head's going to be forward, and a lot of people have been taught to perform a posterior pelvic tilt, which is tucking your tailbone underneath your rear end. That allows to open up the stenotic channel and release the nerve pressure, allows you to stand and walk longer without pain. And this is good for the short term, but for the long term, what that does, programming in poor posture, which the joints, the spinal joints and discs are going to be out of alignment. And if it's chronically out of alignment, which means the osteoarthritis, which caused the spinal stenosis, is going to get worse over time. So in other words, we have to start programming in that proper posture so it doesn't get worse over time. So you want to perform the stance. We have a video that goes over the stance in detail, and you may want to check that out. But for right now, stand up, put your feet hips width apart, toes lined up with the knees, knees with the hips. You want to screw the feet into the ground. That will contract the glutes, and at that same time, you want to brace the abdominals. Then you want to try to bring your ears over your shoulders. And the only thing you got to watch out for is that by bringing your ears over your shoulders, you may find yourself arching your low back, which means you're releasing your abdominal muscles. So you want to keep the abdominals braced as you bring your ears over your shoulders. Once you practice setting that stance, then you're ready to step up on that treadmill. So you step up on the treadmill and you get your settings, your incline correct, and your speed. Now with the incline, you may start off in a 2 to 4, but you may start going down to 0. And you want to play with that depending on how it feels. Now, as you start your gait cycle and start your walking, you want to brace the abdominals and you want to get a good arm swing in. Now, by bracing the abdominals and swinging those arms, you're going to activate the latissimus dorsi. You're going to activate the abdominal muscles, and that's going to pull in the thoracolumbar fascia. It's going to cause a nice little decompression effect on the vertebrae and allow you to walk longer without pain. So it's important to brace the abdominals and get a good arm swing as you walk. So one of the mistakes and one of the things you want to avoid is to use your cell phone as you walk, because that will put you in a poor posture and it will actually make things worse as you go. Also, you want to avoid just watching that monitor out in front of you. So really the idea is you want to brace abdominals, get a good arm swing, and then you want to look out in the horizon as you walk. Next, you want to continue walk. You want to start your walk, keep that gait going until you start feeling pressure right before you start feeling pain. Once that comes up, then you want to self-decompress. Self-decompress, you stop and decompress and get your whole body weight off, or you can try the self-decompress as you walk. Try it out, see what works best for you. And you want to keep that going until the symptoms dissipate. It could be 15 to 30 seconds, and you want to resume that walk. Keep that walk going, brace abdominals, keep the arm swing going, and you keep going until you start feeling the pressure build up. Then you self-decompress again. Once the pain and pressure is decreased, then you can resume your walk. And you want to keep that going until you get to the desired distance. And you're going to find as time goes on, as you're going to walk farther and farther without having to decompress, till eventually you're going to be able to do the whole 2 miles and not have to decompress. This is going to translate when you're off the treadmill to you're going to be able to walk miles and miles without any pain with that lumbar spinal stenosis. Lumbar spinal stenosis is caused by degenerative disc disease or osteoarthritis. And that's where you're going to have those discs. They're dehydrated, they're dried out, they're desiccated, they're like beef jerky. So make sure, check out this video right now. It's going to go over one exercise that helps rehydrates the disc by reestablishing the motion within the disc. Now, if you like this information, you want more of it, just go ahead and subscribe. We really appreciate serving you. So share this information with whoever really needs it. And we look forward to seeing you on our next video.